Hello friends, welcome again to my channel where we discuss the science behind this world of medicine. So today we will try and understand what is the significance of the blood pressure readings and what they exactly mean. Most of you here might have got a blood pressure testing done at least once in their lifetime up till now. And when you get a blood pressure testing done through a medical device called as sphygmomanometer, which is tied around the arms, you might have noticed that your blood pressure reading has two values. What you call as the upper value is the systolic blood pressure, and what you refer to as the lower blood pressure value is the diastolic blood pressure. Now, what exactly does the systolic blood pressure and diastolic blood pressure mean? So, to understand this further, we need to understand how blood flows inside our body. Heart, which is the main supplier of the blood, heart beats every minute. It is beating like 70 to 80 pulses per minute. It is pumping the blood to your body organs. So when a heart contracts, it supplies blood to your body organs, tissues and cells. This blood that is supplied carries oxygen and nutrients, and this called as a pure blood is carried through arteries. So there are large arteries, smaller arteries called as arterioles, and then finer arteries which are called as capillaries. These are different terminologies for the wholesome group of arteries which carry the pure blood. Now, when the body organs, tissues and cells utilize the oxygen and the nutrients, they excrete out carbon dioxide and other impurities, and again this is carried through some blood vessels which are called as the veins, which particularly carry the impure blood, what is we refer to as impure blood, back to the heart. Now it is important to understand that your blood pressure reading is taken in the arteries. What you tie around your arm, there are some arteries which is called the brachial artery, around which traditionally and conventionally the blood pressure reading is done. So to understand this further, when a heart pumps, the blood is traveling through the arteries, and when the heart is contracting, it is exerting its maximum pressure, and you will realize maximum flow through these arteries, and this is referred to as systolic blood pressure. So the pressure which is measured during the contraction of the heart is called as the systolic blood pressure, and you can appreciate then when the heart is contracting, it might be exerting the maximum possible pressure and referred to as the higher level of the blood pressure or the systolic blood pressure. But during these contractions, there is also a phase of relaxation where the heart is relaxing. During that phase, what pressure we measure is the diastolic blood pressure or the lower level of the blood pressure or the resting blood pressure. This is when the heart has already done its pumping action and is now in resting phase. The blood pressure that remains stagnant or remains as it is during 100% of the times is called as the diastolic blood pressure or the minimum level of the blood pressure or the resting phase blood pressure. So now when you understand what is the systolic and diastolic blood pressure, now let us look at what contributes to this increase of blood pressure in case of hypertension. There are two primary parameters which can be easily explained which contribute to this blood pressure. The first parameter is cardiac output or the output from the heart. This is the amount of blood that flows from the heart is a contributory factor to the blood pressure. When we refer to cardiac output, we again refer to two things. The first is the stroke volume. Stroke volume means how much blood heart is pumping in each contraction. So you can easily imagine that if there is a blood vessel which carries X amount of blood, and if you pump more blood through it, the pressure exerted will be more because the blood volume or flow is more. So this is referred to as stroke volume, and higher the stroke volume, higher the blood pressure. You can easily understand in hypertension it is told that you should restrict your salt intake. Why? Because the more salt you intake, salt attracts water. So if you remember my video on osmotic regulation, salt will attract water. You consume more salt, your blood volume increases, and hence each contraction of the heart pumps out more blood. So this is referred to as increased stroke volume contributing to higher blood pressure. The second phase of cardiac output is heart rate. So if my heart is pumping too fast, again it will exert more pressure on the walls of the blood vessels, and hence your blood pressure may increase. You can easily appreciate that when you do some strenuous exercise and you run and you jog, you might feel your heart racing a little bit, or during times of fear, anxiety, you might feel palpitations or heart beating fast. During that time, if you measure your blood pressure reading, you will find that marginally increased. The reason is heart is pumping out very fast. So during fast pumping action of the heart, the blood vessels again have more pressure inside them, the arteries have more pressure, which is referred to as with the increased blood pressure readings, maybe systolic as well as diastolic blood pressure. So the primary effect is on the systolic blood pressure, but again, if systolic increases, the resting will automatically increase. So this is referred to as the cardiac output or the heart related conditions which are contributing to the maintenance or the increase of the blood pressure. The second is peripheral resistance. What do I mean by peripheral resistance? Peripheral resistance is that the blood is traveling through these vessels. These vessels have their own contraction ability. So when blood flow through these arteries, they can contract, expand to maintain the blood pressure. Second is they have a particular size of the lumen. The blood vessel have particular size. If this size reduces, again there will be changes in blood pressure. Let us look at how. So when I refer to as blood vessels contraction and expansion ability, this is referred to as blood vessel elasticity or the elasticity of the arteries, arterioles and the capillaries. The group of vessels referred to as arteries carrying the pure blood. So during sometimes what happens is this elasticity is lost. So we refer to as vascular structure changes. So what happens in vascular structure changes is, or the functional changes is, the blood vessels do not contract properly, or they lose their contraction expansion ability, or they lose their elasticity. During these times what happens is, if you flow blood through this, more blood flows, pressure increases suddenly. For a small increase in blood flow, the pressure rises exorbitantly. The reason is the blood vessels have lost their capability of elasticity, contraction, expansion, which regulates the blood pressure, and hence you have a higher blood pressure. This can be easily found in two stages. So as you age, as the age of a person increases, the doctors would say that higher blood pressure is a little acceptable factor. The reason is, as you age, the elasticity of these arteries or the blood vessels reduces. As the elasticity reduces, you will have a higher blood pressure readings. This is a normal phenomena, but in pathologic phenomena or in disease state, what happens is, in earlier stages of life also, in younger age also, these blood vessels may have arteriosclerotic changes, wherein there is calcification in these blood vessels and they lose their ability to maintain the pressure or lose their elasticity. This is referred to as a disease state and raises the blood pressure of an individual. This can be easily attributable to a lot of things like high cholesterol levels, smoking, alcohol, and there are a lot of other factors which contribute to this arteriosclerotic changes or the changes in the peripheral resistance due to vascular function. Now, the second change that is happening in the peripheral resistance is the vascular structure, or what we refer to as the lumen size. What happens in this is, in vascular structure, the lumen size will reduce. This is happening when there is plaque deposition or there is cholesterol deposition, referred to as atherosclerosis. So atherosclerosis, what happens is the lumen size reduces. When this lumen size reduces, you can effectively understand, so whatever X amount of blood I was flowing, that is now flowing through a smaller size. So it will exert more pressure and hence your blood pressure rises. So again, this happens when you have high cholesterol levels in the blood for a longer period of time. You have a sedentary lifestyle. Again, smoking is a risk factor for atherosclerosis or decreased lumen size, effectively leading to peripheral resistance and higher blood pressure. So I hope now you understand what exactly is systolic blood pressure, diastolic blood pressure, and how they are maintained or a higher levels is reached in each of the cases. Obviously, there are other factors which are contributing to higher hypertension or increased blood pressure, which are not the scope of this video, but you can understand the basic phenomena of blood pressure regulation. And a doctor is always looking at the three readings to take a medical treatment. So first reading is the systolic or the upper level of blood pressure, diastolic or the lower level of the blood pressure, and the pulse pressure. Pulse pressure is the difference between the systolic and the diastolic blood pressure. So a doctor would look at all these three things to decide upon the kind of medication that needs to be given and the kind of advice that we need to give to a patient. So I hope you have understood and thoroughly gained knowledge about the blood pressure regulation so that you can do some implementation in your lifestyle changes, your food habits, so that you can actually contribute to a healthy living. Because I understand there is science behind everything a doctor would tell you, a doctor would recommend, and there is science behind any illness. And if you understand that science, you can maintain a healthy lifestyle, because understanding creates compliance. If you like my video, please like, share and subscribe, and don't forget to watch my next video. Thank you.